Well, hi, Tony. How you're doing? Obviously, today we're going to be doing another session with Dr. Dave. How do you? I know he's not here yet, but how do you feel? First of all, how are you doing? Oh, I'm just fine, Miss Rudy. How are you? I'm doing okay, but I have to tell you, I am not real thrilled with this therapist. He's kind of a dork and maybe a bit of a jerk. What do you think?
Oh,
Oh,
did I hear somebody talking about me?
hi, Dr. Dave. Hello,
Hi.
Dr. Dave.
Oh,
How's it going?
hello, and nice to see both of you. By the way, there's a little matter of your bill. I still have not.
Oh, with the bill again.
I don't work for free. I'm a highly trained professional. Hello, Tony.
Hello.
I'm a highly trained
Hello.
professional,
Hello,
and
Dr.
I've made
Dave.
exactly only $50 of your credit card money has come through. Sessions.
I don't know what to say about that. Shall I give you cash?
It's really not nice to be a deadbeat.
Tony, do you have any cash for Dr. Dave? I told you once. I told you once. I told you 10 times. I don't make any money. And I feel like you're trying to rub that in that I do not make an income. You know, I am a turtle, right? I'm not a person. I'm a turtle. Right, with a brain the size of a milk dud. We've been over all of this before, but apparently Dr. Dave is not getting paid, and he is a highly trained professional. So,
Ruby, I graduated from Manitoba University.
in Saskatchewan,
Yes, in Canada. And it was cold.
it was cold, and so you're saying you deserve to be paid.
Yes.
Well,
know-
I feel like we can't. It's not ethical of you to spend the whole time talking about your pay.
It's not ethical of you to not pay me.
I don't have to be ethical. You're the therapist. That laugh is insane. It is an insane laugh.
Excuse me, but
Yes.
the
Yes, Dr. Dave.
psychiatric rules of professional
Psychiatry?
psychopathic responsibility say that if I do not get paid, I can, once the patient has stabilized, I can tell them I'm no longer going to treat them. So as long as you're not suicidal or...
Do you feel like we're actually stable at this point?
No.
I didn't think so. Tony, do you feel emotionally and psychologically stable? Well, not really, no. I have been pooping all over your floor. Just thought I'd let you know. So I do not think that is a sign of emotional stability. So I don't think you can terminate us yet.
Incontinence. That is not insanity. That's just fecal incontinence.
Well, Dr. Dave, I have to dig to differ because I have been wiping my feces all over the wall. So I think that adds a new element to the whole thing. So psychologically, I would say I'm not quite where I need to be, if you know what I mean.
Can I make a suggestion? Because I am an MD, I'm a psychiatrist as well as a therapist, and I'm MFT as well.
Right, you've said that before.
Yes, and I went to Manitoba for
Oh,
medical
gosh.
school.
Okay.
And it is the 39th best medical
We're going to have to get
hospital
another therapist, Tony.
in Saskatchewan.
I think I'm starting to agree with you. This is the first thing we've agreed on in about 3 months.
I'm going to make a suggestion. Ruby, you go on 400 shit tons of Valiums.
Please don't cuss.
Oh, sorry.
I want to
I
show...
meant 400 milligrams. Did I say milligrams?
Yeah,
Okay, that's not cussing. Milligrams is not a bad word.
but you did say S-ton before.
Oh, okay. And Tony, I think you can do. I would run away if I were you, Tony, because she's no good for you.
Tony, Dr. Dave, can we get started on what the issues are for the day? I have some very serious problems with Tony, and this is relationship counseling.
Oh, okay. So what is the problem with the relationship?
So today, I would like to bring up the fact that Tony has developed a very serious superiority complex. Ever since we've been on YouTube, he thinks he's famous, and it's just it's not an accurate description of things. And I'm actually wait a minute. I don't know that it's that I think I'm famous. Other people think I'm famous. other people think I'm famous, and so what's happened is, Dr. Dave, if you'd like to know the facts of the situation, is 3 people came up to me this week and asked for my autograph, and no one has asked Ruby for her autograph. That's true. But the problem is I had to sign for him because, he can't sign an autograph. So, I'm not very happy about it. And ever since he's become supposedly famous, he's impossible to live with. He's been dropping turds all over the floor. He doesn't pick up after himself. This is just terrible. So, what do you think we should do?
Oh, well,
Dr. Dave?
I think you should, for health purposes, you should continue to clean up his feces.
Mm-hmm.
That's what you can do, and you can support him because.
The trouble with the feces is, and I have to agree with Ruby on this. Again, we've now agreed on 2 things in 3 months. Is that a couple of people that she had over thought that the feces, the little nuggets, were milk duds, and they ate some. Oh, I didn't even know that. So, I'm beside myself trying to deal. Actually, I am literally beside myself.
Well,
being a ventriloquist.
Can I say that in my...
That's a fake laugh, Tony. I'm getting tired of it.
I get it. Okay. Now, may I suggest that since Tony isn't... Okay, in my practice, I have 9...
Oh, God, here we go again.
I have 9 turtle owners.
Such a braggart.
I have 9 turtle owners in my practice.
Mm-hmm,
Each and every
9 turtle owners?
Each and every turtle owner...
I'm actually a tortoise, right?
Oh, shut the fuck up. Oh, sorry.
Oh, God, here we go again.
Beep, beep that up. Okay, but anyway, the shelled animal owners are all smart enough to understand you put the pet in a pen and you let him do his poopies in a pen and you let him hibernate for many months out of the year. Or do you let him hibernate?
I don't want to hibernate! That's for losers! There's plenty of time for me to sleep when I'm dead.
It's most likely that your lack of sleep is making you psychotic.
Me or Ruby?
Tony.
Tony.
Ruby is psychotic, congenitally speaking.
Genitally speaking?
Congenitally. I did not cuss you. You put that cuss word in my mouth.
Congenitally speaking.
You keep your genitals out of this.
Okay.
Okay. So.
That's a deal.
Okay, yes. So I think perhaps make Tony a suitable place to be a tortoise head or whatever he is. I'm not sure. And
I'm a tortoise! I've told you 10 times.
And make sure he gets
Tony, be polite.
Make sure he gets plenty of sleep. And if I were you, I would continue with the diet and the plastic surgery.
Myself? For me?
For you.
Oh, I have some news. Speaking of diet and plastic surgery,
okay.
I was I went to my tryouts for my floor exercises for the Senior Olympics. Oh yeah, that was a real loser. Shut up, Tony. Anyway, I didn't get in, but I was told.
Excuse me. Let me get over my shock. Okay.
I was told to come back in 4 years and try out again.
And I would for the 90 and over age group.
Well, I mean, I will be a little older.
Yes. And
that's true. But isn't that exciting? I'll be able to try out again.
Is this like the?
Well, wait a minute. Wait a cotton picking minute. Does he know how old you are? The judge, does he know how old you are? What are you talking about? If you're here in 4 years, I'll eat my shell. That is cruel. Tony, I mean, Dr. Dave, can you stop this? He's giving me an inferiority complex.
Tony, do not talk about Ruby's mortality. Do not do it. It's not fair. Ruby might live another 6 years. It's possible. I've seen people live to 120. And,
I'm probably going to live to 120 because I'm a tortoise.
Yes, but don't brag. Don't be braggadocious.
And the other thing is, Tony is acting up because he thinks he's famous now because he got those 3 requests for autographs. But what Tony doesn't realize is that our YouTube video is having some problems. The last time we did a video, we got 6 views.
Oh.
I think the number's going down every time.
Can you monetize 6 views? I don't think you can.
I don't think so.
Because, well, I'm not going to name any names, but one of my patients has a male OnlyFans, and he said if he only has 6 viewers, he's not making a living. So you might want to consult with a social media expert.
Well, again, you told me Tony can't get another job. This is the only thing that we can do together that involves Tony, because Tony apparently can't work because he's got a brain the size of a milk dud. Please don't bring out the size of my brain again! I'm sick of it!
Wow.
I mean, his brain is small. Can you tell him? Just reveal the truth to him? His brain is tiny, right?
I don't think that's necessarily true.
Well,
Tony?
Look how big his head is!
Tony, what's 11?
Look at the size of his head!
Tony, what's 11
Don't
times
touch
9?
my head!
Tony, what's 11 times 9?
122. No, 190. 17.
Oh. Tony, you're
Do you
not
see
big
why he
enough.
has to live with me and why I have to take care of him? So he really should be treating me with more dignity and respect.
Okay, Tony, there's a phrase I like to use in my couples counseling. I know you're not a couple per se, but I like to tell the old men to just placate the old lady, and I think that's something you should try to do.
We are definitely not married. If we were together as a couple and we had children, they'd look really, really freaky.
I understand that, but the same is true. I find that if you take your problems and you stuff them down really far and you ignore them, then they will not come to the surface, and you can have a much more pleasant life.
Is that true? Tony, is that true? I don't think it's.
That is what they told me at Manitoba. I'm not sure if that's true or
Okay,
not.
well, I think
But,
you might have to research. We might have to Google that.
Okay,
Because
but whatever you do, don't be direct with Ruby because she can't handle it.
I'm a little unstable. Dr. Dave, I was wondering if, just for my peace of mind, we could next week do a psychological evaluation of Tony. I heard that!
Yes, you can do the Manitoba multi-phasatorial DSM-9, which is something I'm working on.
Okay, was that a test or a book?
It's a book
I think the
of
DSM
tests,
is
or
a-
it's
is
a
a
test of all the books. And
Test-
what it does is it tests all the psychological books.
I think that Dr. Dave might have some kind of a learning disability. Ruby.
Tony!
What?
How dare you insult your therapist?
Oh, Dr. Dave, I was just being honest. You don't seem like you're all there, honestly.
If you were a bunny, I would say insulting your therapist isn't funny, bunny. But you're not, so, damn. Okay. If Bunny were here, Bunny, have you ever heard of Bunny Brugger?
Bunny Bruning?
Bunny
Bunny
Bruning?
Bruning. I think we're getting off topic.
We are. Yes. I'm obsessed with her, though. She was a wonderful tennis player.
She is still alive.
I know, yes, I believe so.
She's still alive. And, anyway, shout out to Dunny Droning! Yay, Dunny!
Yes.
Did you know Dunny's coming back to visit us in March 2025?
I'm going to work with her. I'm a sports psychologist, and we are going to make she's going to make a comeback.
Okay.
Not on the senior tour, she's going to make a comeback.
On the junior tour?
No, on the Real Women's Tour.
I think we're going to have to close up this session, Dr. Day, because I got to go to the bat room, and I got to let go of a little milk dud.
I don't really think we've accomplished much.
Tony, that is such a
Have we
rude thing to
accomplished
say.
anything today?
You have not helped us one little bit today. In fact, if anything, I think Tony and I are very unified on the notion that you stink.
Well,
What do you think, Tony? No offense, Dr. D, but you stink! Wow, wow, he said, you know, his voice is getting loud. It's really getting on my nerves.
I think that the both of you are deranged beyond any
Wow!
help.
I am so hurt right now. I'm
However,
gonna
I
cry.
would encourage you to catch up on your bill, and I will medicate you appropriately.
How about this? How about Tony pays the bill next time?
You know,
Again! I have the brain the size of a milk dud! You don't have to sing it. Thank you.
Tony, you were worried about Ruby maybe not having 4 more years on terra firma or this planet.
Mm-hmm.
But if she does not pay her bill within 4 years, I will give her more time. So, anyway, if you could, Roanne is my secretary,
Mm-hmm.
and on the way out, if you could pay her.
We'll do, Dr. Dave.
Okay.
Okay.
Because
Good night, Dr. Dave. We'll see you next time. Oh, before we sign off,
Oh, wait,
could you
before-
guys look at my Halloween costume, please?
You
It's
look great.
very.
Before
Look
we
at
end
I've
the
got the
session-
witch. It's a witch costume.
Before we end
Today's
the session,
Halloween.
I have to say this is the worst session I've had in my entire career, and I have therapized crack whores, crack addicts, and murderers, and I feel more hopeless after this session. So hopefully you guys can make me feel more hopeful next session.
We're gonna work on it, Dr. Dave, because we really want to get better.
Okay.
All
okay.
right. Bye, Tony. You know what, Tony? I feel like maybe we should hug each other. What do you think? Can we have a hug, Tony and I?
You can. However, please be careful. Respect his private parts.
Okay.
Oh, that's precious. That's precious.
I love you, Tony. I love you too, Ruthie. Bye. Bye. We'll see you next time.